In this video by deckplate, we will understand the VA disability ratings for hairy cell and other B-cell leukemias. Agranulocytosis, acquired, polycythemia vera, splenectomy, spleen, injury of, healed, aplastic anemia, essential thrombocythemia, and primary myelofibrosis. Chronic myelogenous leukemia, CML, chronic myeloid leukemia, or chronic granulocytic leukemia, acquired hemolytic anemia, myelodysplastic syndromes. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. The VA assigns disability ratings to various blood disorders, taking into account the type, frequency, and severity of treatments and symptoms. Each diagnostic code includes ratings with specific criteria, providing compensation that supports veterans in managing their health conditions. Agranulocytosis, acquired. Diagnostic code 7702. This condition involves extremely low white blood cell counts, rated based on the need for treatments like bone marrow transplants or growth factors to manage neutrophil counts. Ratings range from 10% for mild cases to 100% for severe recurring infections requiring extensive treatment. 100% requiring bone marrow transplant or infections occurring on average at least once every 6 weeks. 60% requiring intermittent myeloid growth factors or continuous immunosuppressive therapy to maintain absolute neutrophil count ANC greater than 500 per microliter but less than 1,000 per microliter. Infections at least once every 3 months. 30% requiring intermittent growth factors to maintain ANC greater than 1,000 per microliter. Infections at least once per year but less than every 3 months. 10% requiring continuous medication or intermittent use of myeloid growth factors to maintain ANC greater than equal to 1,500 per microliter. Note: a 100% rating starts on the date of transplant and continues until a mandatory VA examination 6 months after discharge. Polycythemia vera. Diagnostic code 7704. Polycythemia vera is a condition of excessive red blood cell production. This condition is rated based on treatments such as phlebotomy, stem cell transplants, or chemotherapy. 100% requiring stem cell transplant or chemotherapy for the purpose of ameliorating the symptom burden. 60% requiring phlebotomy 6 or more times per year or continuous molecularly targeted therapy to control RBC count. 30% requiring phlebotomy 4 to 5 times per year or continuous biologic or myelosuppressive agents to maintain platelet or WBC counts. 10% requiring phlebotomy 3 or fewer times per year or intermittent biologic therapy as needed to maintain all blood values. Notes: complications like hypertension, gout, stroke, or thrombotic disease are rated separately. If the condition transforms into leukemia, it's rated under diagnostic code 7703. Splenectomy. Diagnostic code 7706. A splenectomy, or spleen removal, is assigned a 20% rating. Note: systemic infections due to splenectomy complications are rated separately. Spleen, injury of, healed, diagnostic code 7707. Residual effects of a healed spleen injury are rated based on any lasting symptoms or functional impairments. Aplastic anemia. Diagnostic code 7716. This bone marrow disorder, where the body doesn't produce enough new blood cells, is rated based on treatment needs, such as transfusions or infections. 100% requiring stem cell transplant or transfusions or infections at least once every 6 weeks. 60% requiring transfusions or infections every 3 months, continuous immunosuppressive therapy. 30% requiring transfusion of platelets or red cells, on average, at least once per year, or recurring infections at least once per year. Notes: a 100% rating applies from the date of transplant and is reassessed 6 months post-discharge. Chronic myelogenous leukemia CML, diagnostic code 7719. This type of leukemia is rated based on ongoing treatments like stem cell transplants, myelosuppressive therapy, or targeted therapy such as tyrosine kinase inhibitors. 100% requiring stem cell transplant or continuous myelosuppressive or immunosuppressive therapy. 60% requiring intermittent myelosuppressive therapy, molecularly targeted therapy, or interferon treatment. 30% in remission but requiring continuous molecularly targeted therapy. Notes: If leukemia progresses, it is rated under diagnostic code 7703. A 100% rating applies during active treatment and continues 6 months post-discharge. Acquired hemolytic anemia, diagnostic code 7723. This anemia type is rated based on the need for treatments like immunosuppressive therapy and transplants. Ratings vary by the frequency and severity of treatments, from mild to high-risk cases requiring constant therapy. 100% requiring bone marrow transplant or continuous intravenous or immunosuppressive therapy. 60% requiring 4 or more courses of therapy per year. 30% requiring at least 2 but fewer than 4 courses of therapy per year. 10% requiring 1 course of immunosuppressive therapy per year. 0% asymptomatic. Myelodysplastic syndromes, diagnostic code 7725. These disorders disrupt blood cell production, with ratings based on treatment frequency, such as transfusions or hospitalization for infections. 100% requiring stem cell transplant or chemotherapy. 60% requiring 4 or more transfusions per year, or hospitalization for infections 3 or more times per year. 30% requiring 1 to 3 transfusions per year or hospitalization for infections 1 to 2 times per year. Note: if the condition progresses to leukemia, it is rated under diagnostic code 7703. A 100% rating applies during active treatment and is re-evaluated 6 months post-discharge. Thank you for watching this video. Please don't forget to subscribe and like our videos.